I'm sure we've touched on some of these issues already, but looking at what does the future of healthcare look like? I suppose maybe the question could also be, what do we want the future of healthcare to look like? What do we want to see going forwards?
I think the future of healthcare, if it's going to be a good one, has to address, day-to-day realities of people and their ability to manage their own care more effectively, and with all of this sort of information that we've talked about, that doesn't always require an intermediary like a healthcare professional. And that safe place doesn't exist at the moment. There is a sort of consumer platform that almost is built around patients rather than around the system. But I think that it will emerge in some form or other, and that's very exciting, I think, because we're all going to experience that, and it's going to be very different.
Yeah, and I would add to that, hopefully, a much greater focus on prevention and keeping people healthy. And reducing the need to even see a doctor and enter hospital, keeping people well in the community over the long term.
I mean, I would say where, the pharmaceutical industry is something that, 5-10 years ago, it was maybe seen as a very transactional relationship between healthcare systems and pharma companies. They did interact, and that was good, but it was very one-on-one. And I think what we've seen in the shift in the last 10-15 years is very much more of a true partnership, a trusted partnership, where, industry is coming together with the NHS to reform healthcare, to better drive patient outcomes, to change pathways, to potentially research new medicines. But that it is seen as a partnership, that the end beneficiary of it is the patient. And I think that building those relationships going forward will be absolutely central, not just for the pharmaceutical industry, but like I said, but for the tech industry. It's going to have to be broader than just the NHS on its own. It's going to have to be the NHS working in partnership to better serve patients, and that's actually going to be potentially even broader than the healthcare system. It's going to have to be social care as well.
And I think that partnership is going to be enabled by the diagnostics that are going to be accompanying our medicines. So, virtually all the things that we're producing into the future will have that kind of companion diagnostic, and it will be much easier to define the population. And you're kind of getting into predictive analytics almost. So that I think the other thing that will happen is, and Sharif, you talked a little bit about this, these things that we're wearing, we're going to figure out which of the measurements matter for different disease states. And, right now we're collecting all this information. Nobody really knows what to do exactly with it, but we're a year or two away from someone sorting and being able to say, that matters for this, and we'll be able to tell an outcome or predict an outcome based on those measures. People are doing it in very high-cost sensors today. I think it'll be much more affordable and accessible to the general population.
There's one word answer to the question you asked, and it's collaboration. It has to be the right way forward. We've had siloed thinking for a long time. People are doing their own things, driven by market, driven by profit, etc. We're into this whole world of the global citizen, if you like. And people now are much thinking about the globe as a whole, about doing good, being philanthropic, as well as making a huge amount of profit. Big Pharma understands this whole concept. So that collaboration is going to be vital to make all this stuff work in the healthcare.
If we look to maybe perhaps the next 12 or 18 months and look at the emerging technology trends, which ones do you think are going to have the biggest impact on healthcare and ultimately provide the biggest patient benefit? And what are the ones to watch?
I was just going to say, I think within the next 12 to 18 months, I think systems which allow you to get answers and not just have to do a random Google search, so something that's going to be able to give you an answer for a list of symptoms that you have, or that's going to very easily connect you to an opinion or some advice that bypasses the process of you even having to go to see your GP first, because I think there's so many barriers within itself that so many people don't bother with minor illnesses and things like that. And I think you need to be able to, these systems will allow people who are busy, who are working, millennials who don't necessarily want to devote so much face-to-face time to healthcare, will be it will provide accessibility for them, and I think that's the first step in tackling so many of these problems.
got a few things I think would be the right in 18 months. I think AI is a big driver, it's a big killer. AI is going to change the whole face of medicine going forward. In 18 months, they'll crack most things that we're talking about. Robotics in association with AI is going to be huge because of the lack of patents have been disappearing from intuitive surgical. So robotics are coming in at a much cheaper level. They're going to be revolutionising healthcare from my point of view. Biosensors, remote censoring of patient data, that's going to be sort of linked with primary care. That's going to be there. My own AR and VR. I think AR and VR is going to be huge. If you think about the drivers of AR and VR, Alibaba put 100 million aside just for tech entrepreneurs in VR in China. Both Google, Facebook, Google released their daydream yesterday based on the new smartphone Pixel 5 and 5.5. They want to revolutionize VR as a tool. So if Google, Facebook, Microsoft, HoloLens, and Apple all driving VR into the market and healthcare, it's going to be the big game changer in 18 months' time.
I love what you said, because I know you've played in the VR space, but that opens a lot of doors, and I think of it as the integration of those things is going to provide new services. And I think that while we may have been a little bit slow to adopt in our industry, I think the services that we can provide in medicine, and that because of the personal nature of the medicine delivery, could actually have us leapfrog what the other industries have done to date.
I think you can see a lot of services using some of these technologies have formed outside of existing systems, and people are using telehealth services, online mobile symptom checkers, wearables, of course, in the consumer space. And I guess you'd hope within the next 18 months more and more those kind of technologies and those services will start to infiltrate the systems and then be more and more used not just by the healthy, well millennials, but actually by people with chronic diseases, people where it can have a very, very big impact on healthcare and costs, and the way those patients are treated and can interact with the system. So I think you're seeing a lot happening outside of existing systems at the moment, lots of consumer technology, quick access if you want a video call with a doctor or whatever, but you're not seeing, I don't think it's transformed healthcare within existing systems yet, and I think more and more you'll start to see those technologies infiltrating the way our own doctors in big systems work. But it will be a lot of seeing it working out in the consumer space, and then having the confidence to try and bring it in, as opposed to being the test bed.
Right.
I think.
Right. And potentially that's a good place to conclude our discussions, and also bring them back to, well, if it's the consumer space that's going to lift the NHS to where we'd like it to be, I'd like to think that millennials' rising expectations for services can also play a part in that. And certainly from what we've heard today, there's still huge challenges. There's still really exciting things coming through in terms of innovation from the healthcare health service, but perhaps still pockets, and it's clear that collaboration amongst all partners is going to be key if we're going to move beyond pockets of innovation to more widespread change.